Hello, today I'm going to be demonstrating the Vivo intensive care bed. So the Vivo bed is a dedicated critical care bed, an integrated dynamic mattress system, which is designed to be used in the intensive care and high dependency units of an acute hospital setting. The bed provides essential systems to support the vital activities used in medical procedures to maintain or improve the vital functions of patients who require monitoring 24 hours a day. Installation staff are responsible for performing the initial setup of the bed, including the setup of any other compatible accessories as specified by the professional user. The bed is intended to support a single adult. A risk assessment must always be performed on the suitability of any ancillary accessories. The Vivo bed is an electrical 4-section profiling bed for the use on intensive care or high dependency settings. The bed must only be operated by personnel who have been adequately trained to do so. The bed maximum height is 82 centimetres and the minimum height is 48 centimetres. The maximum safe working load is 260 kilograms or 40.9 stone. As the weight of the mattress and any accessories needs to be taken into consideration, the maximum user weight is now 200 kilograms or 31.4 stone. The bed frame is suitable for patients up to 198 centimetres in length and 221 centimetres in length when the bed is fully extended. Please refer to the full user manual instructions for any contraindications when using the profiling functions of the bed. It is the responsibility of the prescriber to carry out the necessary risk assessments to ensure the suitable product compatibility for the environment it will be used in and also the safety of the patient. The risk assessment should include, but is not limited to, entrapment, falling out of bed, smaller adults, patients who lack capacity, unauthorised people with access to the bed, the use of side rails and other accessories. Always refer to your local policy and guidance on equipment selection and to the full user manual instructions and guidance prior to using the product in relation to safe use. Before placing the patient onto the bed, it is essential to ensure that there are no obstacles around the bed space that may interfere with bed functionality or may cause an obstruction or trip hazard. Connect the electrical power cable to the nearby socket, ensuring that it is not trailing or causing an obstruction. The Vivo bed is intended to be plugged in to a permanent mains power supply. However, it also has a battery backup system for such time that the main supply is not available. Ensure that the bed is switched on, the mattress is fully inflated, and the LED panel on the footboard is switched on. Ensure that the mattress is secured to the mattress platform. Total setup of the bed and the mattress is approximately 1 hour. The bed platform is designed to accommodate the integral dynamic dual therapy mattress system. However, the bed frame without the mattress is also available. It is therefore the carer's responsibility to ensure that any other mattress used with the Vivo bed is compatible. There are 4 brake pedals, 2 at the top of the bed and 2 at the foot of the bed, which operate all 4 casters simultaneously. When the brake bar is down and the red marker is to the floor, this means that all 4 casters are locked and the bed cannot move. When the pedal is horizontal, this means that it is free and the bed can move and swivel freely in any direction. When the brake bar is up and the green marker is towards the floor, the 5th wheel is now engaged. This means that the casters are set in a specific tracking position, allowing a directional function so that the bed can be pushed from the foot end. Use both the headboard and the footboard to manoeuvre the bed where possible. Ensure the brakes are applied when the bed is stationary. The bed also has a brake alarm which is activated as soon as the brakes are released. If the bed is to be taken on a journey to another department, the brake alarm will cease until the bed is plugged back into the mains power supply. The headboard is easily removable by rotating the dial to the unlock position. To lock the headboard in place, rotate the dial to the lock position. The headboard is lightweight and easily removable by holding with both hands and lifting squarely. The footboard should remain in place as this is where the clinical functionality is located. The footboard should only be removed if it is faulty. The angle indicators facilitate the optimum positioning of the bed for the patient's comfort and recovery. The Vivo bed is fitted with two types of indicators on both sides of the bed to show the backrest angle and the platform tilt angles. There is an integrated oxygen cylinder holder with flexible sizing for a range of cylinders located at the head of the bed. There is an X-ray facility in the backrest of the bed. There are 4 receptacles for IV pole holders in each corner of the bed. Each receptacle allows for 1.25 kilograms of weight. The backrest has a head of bed angle of 66 degrees. The split side rails contain an integrated bed functionality which is duplicated on both side rails so that the patient can be nursed from either side of the bed. The same functionality can also be accessed from the touch screen on the footboard. The split side rails incorporate head of bed angle, integrated one-touch caregiver controls, patient controls on the inside of the side rail, Trendelenburg and reverse Trendelenburg angle indicators. There are hip angle indicators located on the inside of the bed frame as a guide to ensure the patient is placed on the mattress correctly. There are accessory holders with hooks for catheters and drainage bags. There is a manual CPR lever on both sides of the bed. There is also an electric CPR. The electric CPR can be found on the integrated controls on the side rails and also on the touch screen on the footboard. The emergency stop button should be pressed if you experience any undesired movement of the bed. Movements will stop immediately and the touchscreen will turn black whilst it is performing a safety check. If a problem is detected, the touchscreen will remain black and you will be required to call an engineer. If no problem is detected, the touchscreen will return to normal. Should there be a fault detection, basic functionality, including CPR, can still be performed. There is also an underbed sensor located at the foot end of the bed to detect any obstacles in the area and to detect when the bed platform is close to the floor. There is also a foot pedal for CPR. The foot pedal also includes a safety bar. This flattens the backrest as well as lowering the bed to a suitable height to perform CPR. The double foot pedal also has a safety bar. This can be used as a hands-free for when you require up-down movement of the bed, or if you want to change the bed position from side to side when lateral rotation is required. There is also an LED that shows when the bed is at its minimum height. The bed functions are controlled by the nurse and patient controls that are integrated into the side rail panels. The patient controls consist of a backrest adjustment, auto contour profiling, and the nurse call button. When activated, the nurse call button will sound an audible alert and the nurse control panel in the integrated side rail will flash. The nurse control panels in the side rails and the footboard have full control capability so that the clinician can lock out individual functions if appropriate to reduce the risk of any accidental operation or injury. To lock out a function, press the lock symbol in the corner of the touchscreen panel. All padlock symbols will blink for 5 seconds, giving sufficient time to disable the function that you no longer want to be active. To lock any other function, repeat the process. When a function is disabled, the corresponding lock will illuminate. When a function is locked on the nurse control panel, the patient control panel will have the corresponding function also locked out. To activate a function, press the desired function button. The direction keys will illuminate with a green light. This indicates the function is now active. Once the function button is active, hold down one of the direction keys until the required position is reached. The function will stay active for 5 seconds. If after 5 seconds a direction button has not been pressed, the function will deactivate and the green light will extinguish. The bed platform height can be raised to a height of 82 centimetres to support a neutral posture when carrying out any tasks. By raising the bed height from a lower position, the patient may also be assisted to stand independently. Always leave the bed in a lower height position, which is safe for patients to exit from the bed. The Vivo bed has a movable backrest. As the backrest is raised from 0 to 60 degrees, it has a backward adjustment of 16 centimetres and an upward adjustment of 7.5 centimetres, increasing the space in the pelvic area, minimising shear and friction forces to the sacral area of the body. When raising or lowering the backrest, it will automatically stop at 30-degree head of bed angle in order for the carer to make a conscious decision regarding raising or lowering the backrest any further. The angle of the backrest should be assessed for each patient. Lower backrest angles assist with pressure redistribution and higher angles with respiratory and other clinical needs. The knee brake will achieve an angle of up to 25 degrees and can be used to prevent the patient from sliding down the bed as the backrest is raised. When the auto contour button is used, both the backrest and the knee brake functions operate simultaneously. Utilising this function can reduce shear and friction forces caused by the patients slipping down the bed, even when the platform is flattened. The position may be able to assist to provide a more natural resting environment and promote comfort for the patient. When placing the patient in the cardiac chair position, the bed frame will lower to a safe position whilst articulating the bed into a natural chair position. The foot end of the bed will also reduce in length to allow the patient to place their feet on it. The reverse Trendelenburg on the bed can achieve a foot down tilt of 15 degrees. When in tilt, in order to level the bed, the opposite direction button should be pressed and held until the platform is level. The tilt may not be suitable for patients with certain medical conditions. The Trendelenburg can achieve a head down tilt of 15 degrees. When in tilt, in order to level the bed again, the opposite direction button should be pressed and held until the platform is level. The head down tilt should only be used with medical supervision and should be prescribed. There is also a vascular position button whereby the patient's feet are raised higher than the heart. There is also left and right 15-degree lateral tilt that can be used when assisting patients with personal care such as washing, pressure area checks and wound dressings. Lateral tilt can also be used to assist the patients moving from side to side and aid the carer to turn the patient if they are unable to do so for themselves. The examination button zeroes the bed platform and raises it to a suitable height to assist the carer when carrying out any patient examinations. There is also a safe exit button. This positions the bed at its minimum height and raises the backrest in order to assist the patient from the bed. The anti-shock button zeroes the bed platform with emergency Trendelenburg. This is useful for extreme head-down tilt where significant blood loss has occurred or intubation or insertion of CVP lines are required. This can be found in the integrated controls on the side rails as well as in the touchscreen on the footboard. There is also a patient anti-slip system. This is an innovative function to reduce shear and the risk of tissue damage during autoregression. It comprises of a concealed opening in the mattress platform which opens during backrest adjustment, seating the mattress and the patient comfortably with minimum movement or discomfort. By centering the patient and reducing their migration towards the foot end of the bed, even sedated patients will benefit from the patient anti-slip system when being nursed at a 30-degree backrest angle. The bed can be extended by 23 centimetres for taller patients. Never extend the bed in the tilted position, level it first. The mattress will intuitively lengthen to fill the gap. The bed has manual, electric and foot-controlled CPR. The handles for the manual CPR are located on either side of the bed frame to flatten the head section of the bed. Pressing the electrical CPR button or using the foot pedal will level, flatten and lower the bed platform. Regardless of the position the bed is in, the backrest will always lower first so that it is flat in the quickest possible time. The CPR will work even if the battery is flat. The mattress has a pull tag CPR which provides rapid deflation of the mattress. This is required to be used alongside the bed CPR. When using the side rails, after a short period of inactivity, the panel will automatically be disabled and go into standby mode. To raise the side rails, lift the rail upwards using one of the top apertures. Once the rail has been lifted to its highest extent, a click will be heard, indicating that the rail is locked into position. To lower the side rail, lift the release handle to its highest extent to disengage. Then allow the rail to arc out and fall down underneath its own weight. The mechanism, when released, will allow a slow, controlled descent of the side rail. The side rails are dampened to reduce any unnecessary noise. The movement and therapy screens are located in the footboard. After 3 minutes of inactivity, it will go into standby mode. The first home screen in the series shows the power button, how the bed and the mattress are currently being operated, such as mattress functionality, head of bed angle, and any patient alarms that have been activated, as well as duplicating the electrical CPR and anti-shock buttons. It is also the screen from which all of the movement screens can be accessed. So movement screen 1 is a duplication of the functionality screen found within the side rails. Any functionality that is required to be locked out can be done so from here. Movement screen 2 allows for more invasive movement of the bed frame, such as the cardiac chair position, lateral tilt, Trendelenburg, reverse Trendelenburg, and vascular position. Movement screen 3 shows the initial mattress inflation. The mattress therapy includes alternating pressure, continuous pressure, maximum inflate, and a comfort setting. There is also a unique pulmonary therapy called pulmonary expansion. Pulmonary expansion therapy helps expand the thoracic cage of the patients who are in intensive care that are undergoing or have undergone mechanical assisted ventilation. There is a pneumatic bladder within the mattress that is located centrally at the back of the patient, which progressively swells, causing the patient's shoulders to retract and the torso to arch. The internal volume of the thoracic cage is further increased, which facilitates better expansion of the pulmonary capacity. The pulmonary expansion can be set to the desired amount of cycles required, which will be displayed in the cycle box. The cycle box will also display the number of cycles left until the sequence is ended. The minutes for inflation and deflation will also be highlighted and again give an indication of how many minutes are left for either inflation or deflation. The therapy can be stopped and restarted if necessary. The operator can check the cell status at any time. When inflation is taking place, the icon will be red, and when it's deflating, the icon will be blue. The comfort setting can be adjusted either up or down to suit the patient by increasing or decreasing the amount of air within the mattress cells. Inflation levels are indicated by means of the coloured bars. Movement Screen 4 allows for the programming of the Class 3 weigh scales. Weigh scales are extremely beneficial in an ITU setting as they show a weight differential such as a gain or a loss, possible overload of fluid, and they can also be used to assist with drug calculations. In order to start to use the weigh scales, we firstly need to zero the weighing system. This can be done by pressing the 0 button. In order to weigh the patient, you need to press the patient weight button. This will remove any previous patient data and also ensure that the weigh scales have been completely zeroed. Place the linens in the middle of the bed and press 0. The patient is now ready to be weighed. There is also an add and remove object button. This allows you to either remove or add anything such as a pillow or a blanket or a sheet to the bed. There is also an option button which changes the weight from kilograms to pounds and also changes the weight display from continuous to on request. In order to weigh the patient, once the bed has been zeroed, as we've already spoken about, the patient needs to be placed into the middle of the bed. Wait for the patient to settle and then press the weight saving button. The weight will show in the current weight square. The screen will also show the initial weight on setup, previous weight since the first weigh, and also the current weight. Home Screen 5 allows for the use of the second pulmonary therapy that the bed has to offer, which is the programmable continuous lateral rotation. The continuous lateral rotation will rotate the patient to a 15-degree angle and can help with reducing ventilator-acquired pneumonias, will help with loosening secretions in the lower lobes of the lungs, and increase oxygenation. When programming the continuous lateral rotation therapy, you can decide how many cycles are required. You can also set the value of the angle for the continuous lateral rotation, which, as I've already explained, goes up to the 15 degrees. There is a pause time between each rotation that can also be set. In order to commence the continuous lateral rotation, press the start button. There is also a stop button for deactivating or pausing the therapy. The final screen has 5 functions available to the carer. The first one is the alarm setting. You are able to set the alarm for a restless patient, which will detect extra movement in the bed from a sedated patient. The patient exit button, which will alarm when the patient has left the bed. And there is also a wait alarm button. This enables you to set a maximum or a minimum threshold, and once that has been breached, the alarm will activate. The second setting is the actual settings button. This allows you to activate or deactivate the nurse call bell, allows you to block the lateral tilting if the side rails are down, allows you to deactivate or activate to pause the backrest when it is at 30 degrees, a change of foot pedal control to allow you to either use the lateral tilt or the variable bed height setting, a language change, a date and time change, and finally a service, which is only accessible to the technician. There are also a range of accessories available for the bed, including IV pole holders, traction kits, line managers, and bed pushing handles. For the full list of accessories, please refer to the user manual for details. So we're now going to discuss battery maintenance for the bed. So firstly, the batteries must be recharged at least every 3 months if the bed is not continually plugged in and charging. The batteries must be replaced according to use every 4 years. A charging time between 32 and 48 hours is recommended to reach 100% capacity. If the battery is almost completely flat and you attempt to use the bed, 3 beeps will sound every 5 seconds. You are therefore required to then plug the bed into the mains charge, as bed movements may not be completely performed. If the battery has a continuous beep beep sound and the battery LED on the home screen blinks rapidly, disconnect the bed from the mains power and call a technician. The bed will continue to operate using battery backup.